Okay, so the purpose of building a case study is really that it facilitates active learning and it enhances higher levels of critical thinking. And it also includes evidence-based decision making. It requires the learner to integrate knowledge from basic science and dental science and include that together with all the clinical applications. And so the case study itself can be used in several ways. We can use it for patient education if it's a one-on-one with the hygienist and the patient, and this would be documenting the changes or progression of health that may help to motivate the patient and the dental hygienist with their therapy. Another reason we would use a case study is to review patient outcomes, and this would determine when goals are being met and identify and make adjustments as needed. And another reason we would use a case study is to provide motivation and self-evaluation for both the patient and the dental hygienist. So the purpose for documentation of a case study is that it's really a whole complete record of the patient care. And so it's really important that it's a thorough record and it's an accurate representation of the patient. So a case study can also serve as a legal document, and it may help form a valuable defense if needed in court. Sometimes with in different insurances, depending on the insurance, they'll want a full case study documentation. They want to see it before they approve or deny any type of claim for a dental procedure. So it's important to get all that stuff into them. You can use a case study for teaching and academic purposes in an academic setting or for professional presentation to your peers. So overall, it really is just telling the story of a patient's care from the initiation of the therapy through the post-therapy evaluation. So when you're developing a case study, there's three things that you need to consider. You need to consider the purpose for developing the case study, who your audience is, and then you need to define what your goal and your expected outcome is. So before you start developing one, there's a series of questions that you really need to ask yourself. And you're going to start with, why do you want to document this case study in the first place? Do you want to share it with your peers? Are you thinking of submitting it to a professional organization or maybe a publication or a journal? You want to think about, does your case study, is it different? Is it unique? Is that why you want to share it? Is that why you want to do it? You also want to ask yourself, what would others learn or see from this case study? And then you want to think about your audience. Are you going to be developing it for personal viewing or professional development? Maybe it's going to be used for self-reflection purposes when you're further along in your career. Are you using it to be evaluated by your instructors, your patients, or your professional colleagues? Or will this be published in a professional journal or a book someday? And so when you answer these questions, this will help you define your goal and your expected outcome of your case study. So there's three major components of a case study. And they are the patient's profile, the clinical evidence, and the case management. So we're going to start with the patient profile. And all this really is basic information about the individual, which really introduces the patient to the audience. So this is really your demographics of the patient. So it includes, but it's not limited to the patient's age, their gender, their ethnicity, their medical and dental history, any behaviors or beliefs of the patient. It might include their professional or familial roles, the patient's social history, any habits that they might have, and always it includes the chief complaint of the patient. So that's all in your patient profile. So this is like the early stages of telling the story. So the next section is the bigger part of the case study, which is all of your clinical evidence. So this is all the data that you've gathered from the appointment. So this would include your extra and intraoral exam, your perio exam, any indices with your gingival plaque biofilm or bleeding indexes. You're going to want to include your radiographic exam, your oral hygiene assessment of the patient, your caries risk management, maybe the nutritional assessment of the patient. And then you're going to want to attach any intraoral photographs or images that you may have taken during the appointment, any radiographs that you've taken, diagnostic study casts, or maybe some supplementary diagnostic test results like genetic testing, the salivary testing, or pulp testing. So that can all be attached with your clinical evidence, all that data. So the last part of the case study is the case management. And so the case management is really your SOAP. So if you're familiar with that, which I know you guys are, in clinic, you guys use SOAP, and SOAP helps you define your treatment plan. And so we know that SOAP is subjective, it's objective, it's an assessment of the patient, and then it's planning of the patient. And so you get all of that together and you focus on specific strategies for the patient. And that could be anything from what you plan on doing in appointment 1 to the instruments you're going to be using, to the oral hygiene education you're going to be giving the patient. And then as you go on through the case, you'll start to develop a discussion, and you'll think about the strategies that you initially introduced, and you'll start to figure out, is this working? Is this not working? Do we need to revise some of the stuff? Maybe you put the patient on a fluoride rinse, but now they've got this massive inflammation in their mouth and you've got to revise their treatment. What are you going to plan to do next? Maybe you're going to introduce Paradex to their appointment. So the case management really is the SOAP of the patient. And this will affect the final outcome or the course of your case study. So there's 2 different types of case study presentations. There is an oral and there is a written. So the oral presentation provides an opportunity for interaction between the presenter and the audience, and it's really to provoke a discussion and provide feedback. And it addresses really important issues, and like I said, it's really for feedback. And this can be a one-on-one discussion if it's between the hygienist and the patient. It can be in a small group of colleagues, or like a study group, or an oral presentation might be given in front of a large audience, maybe for a CEU course, or like at a public meeting if you're addressing oral health education. The written presentation is a little bit more thorough and accurate. And the written one is often for if you're going to, I don't know, give like a presentation to perhaps a journal. So when you're submitting it for publication, sometimes your audience is not known. If you're doing it for a hygiene journal, obviously we can assume that your case study is going to be written by read by a bunch of hygienists, so that when you're writing it, you can use all of your dental terminology. But if you're submitting it to a publication that the general population is going to be reading, you're going to want to watch your language so that it can be easily understood by the general population who may not understand dental or medical terminology. Does anybody have any questions so far?
I don't.
No, everybody good? Okay. All right. So now Ashley and I are going to try out how to build a case study. So this is just a little fun exercise that will hopefully help you when you're doing your assignment. So Ashley did this great case study, and I'm going to have her chime in, and we're going to go over this together, and then we're going to ask a couple of questions.
Yes. So this form that you guys are looking at right now, which I know that Mrs. Valerie sent you, this form actually was what was required to take your clinical boards. This had to be filled out prior. You got a huge stack of paper and you had to fill all this stuff out. This is most likely not the case moving forward as long as they're using the mannequins, but if they ever go back, or if there's some sort of a, you know, something happens this year and COVID's not a thing when you guys take it, you are required to fill this out. So you can see it's pretty much broken down by quick demographic on the top, followed by the chief complaint, medical history, medications, dental history, and social history. When you are creating a case study, you can do it a couple ways. You can either base it off of a real patient, or you can make everything up and base it off of existing radiographs or intraoral photos that you actually have. So it can go either way. In most cases, you're probably going to base it off of a real person. You might have to change the name to follow, to go in coordinates with HIPAA. You might change a couple things here and there to make your presentations if the patient doesn't quite have enough medications or a thorough enough medical history and you want to add something to make it a different ASA, that's an option as well. For this case study, I actually had, I made this during quarantine for the students last year for them to do supplement for their requirements. I worked backwards. So if we go to the next slide.
Okay.
I first started with existing x-rays that I found online, and then I read them and worked backwards. So the restorative chart section with case studies, you're usually going to have a key or a legend on the bottom, just because to make sure everyone understands the charting. The charting should be more universal, but in certain cases, you might want to just write down green means this, blue means this, and then the different markings as such. So with this intraoral examination, again, I went off of the existing radiographs and or the intraoral photos that I found that looked like they could go hand in hand. You want to be as specific as you can, but you don't have to go too overboard. You want to just give a really good overview of the patient so that you're able to make some really good questions and kind of base it off of it. So if we keep going, you can see the next one should be, so again, accretions chart. Quick pro tip, if anyone has an iPad, I used an Apple Pencil to go ahead and draw the different colorations. If you don't have that, you can use the regular paint program or Photoshop or anything like that to go ahead and color in the actual accretion chart. And again, there's the legend and the key on the bottom that describes what the different colors mean, because you're going to be adding different things into one chart. And again, I wrote down the different accretions that were found. And the next page is going to be the perio, which again, if you have an existing perio chart or an existing dental chart already, like an EagleSoft, and you guys are making it off on a page that already exists, then you can totally just copy that and put it in, following HIPAA, of course. But this is following the same exact paperwork that was required for the clinical board examination, with the key on the bottom. And then I kind of broke down how to find the CAL, and everything is marked this way. So paper charting does come back. It comes back to get you eventually. So be familiar. And then the following is when we go ahead and we add in the different aspects. So for this one, I added in intraoral photos. It's always important too to mark it down by the different figures. So, you know, figure A, figure B, and different things like that. These are great to have, especially if you're going to be making up questions to ask your peers or your classmates. You can see that we can already kind of break down and think about different questions we could ask about the alignment of the teeth. If you're able to get a really awesome side view, you can even ask questions about the occlusion class. Another great one that is awesome to ask is you can ask about what adjuncts you can have the patient use or what you think they should use. So right here, automatically, you can notice that there's a wider embrasure space with a diastema, so you can recommend using an interdental brush or anything like that. So you can always work off of that. And then the next slide is going to be radiographs. So, you know, the cool thing about a case study is you can almost think of it, sometimes it's like playing Jeopardy, where you're given the information and then you have to think of the question. So you work in that kind of way. So what we're going to do next is we have some blank ones, and we're going to create one together, and we are going to go ahead. Here we go. So for this case, what we did, and what I suggest you guys do as well, because you'll most likely be doing a PowerPoint case study in the future, is I took a screenshot of the case study format that was sent to you guys, and then right on PowerPoint, you just take a text box and you can go ahead and have that there. So Mrs. Valerie is going to have to leave the presentation screen and go back to the editing screen and type some things in. And we'll give this one a go.
Okay.
There we go. All right, so whoever wants to participate, just unmute and join us in this one. So on the top where it says case, most of the time case studies are going to be either marked by a letter, by a number. You can even do a fake, a fake chart number, a fake name is great too, whatever you want. So we can make up a fake name or anything like that. So if anyone
chime in.
Go ahead, Val, make up a name.
Let's call it, we'll just say John Smith. How's that? All right. Oh, Mr. Smith.
Yep, you're right. Just go to the side arrow and drag it out. Yep.
Okay. All right. So now we have to pick, how old is Mr. Smith?
So this is a really good one to always think about too, because with every age or different category that you have a patient, they're going to have their own unique things that you're looking out for. So for example, if you decide that you are doing a pediatric patient, it's important to make sure that everything else follows as well. So for example, if you decide that you're going to have a pediatric patient, make sure for social history, you don't say that they enjoy hanging out with their grandchildren, because if they're 9, they probably don't have any. So make sure you always kind of keep in mind that you're doing the right sort of thing.
Okay, why don't we think of John Smith as middle-aged? How's that?
Sure.
All right, so John Smith is 42. And he is male.
Just leave it. It's fine.
Okay. He's male, and I can't check that. Okay, so we'll give him, go ahead, Ashley, think of a height for John Smith.
So does anyone know why height and weight can be important to include in a case study?
Maybe overweight. Patients can be overweight and you need like special considerations, to the height and the
Exactly.
Yeah.
So there are certain aspects you're going to look at. So you can take into account BMI. You can
Right.
always take into account nutrition and counseling, but you're also going to take into account different dosage of medications depending on how much a person weighs too. So it's important to kind of have that.
All right, we'll make John Smith 6 feet. How's that? Okay, and what do you think for the weight?
Let's say that John Smith, let's say that he weighs 200 pounds. So he's fine. So we'll just say he's 200. So don't think about that because
I deleted it. Okay. And his blood pressure.
Let's say he is 145 over 82.
Ooh.
Does anyone know what classification of blood pressure that would be?
I almost said it.
weight.
Stage 2.
What, 145 over 82?
Stage 2.
Yes, good job. Good job. Good job. All right, chief complaint, go ahead.
Make it up. Anybody?
To sensitivity.
Perfect.
Okay. Is it generalized? Is it localized?
Localized.
Okay.
I'm just listening. I'm driving while I'm trying to.
You're doing great. No, it's fine. Thank you.
Yeah.
So this is great. So under his chief complaint, you can say sensitivity localized. In most cases, you're going to be taking a direct quote from the patient. So you can say in quotations, my teeth are sensitive when I eat something hot.
Right.
And that's usually how you phrase the chief complaint. All righty, let's get a good medical history going.
So what's going on with this patient?
Hypertension.
Hypertension, good. Okay. Yes, exactly. So let's say that they have high blood pressure.
Probably hypercholesterolemia.
Okay, high cholesterol, okay.
Okay. When was his last exam? When was the last time he saw his doctor? Maybe a year ago?
Sure. Perfect. And you know what else we'll do? Let's say that the patient also recently had a knee replacement. Left knee.
How about we'll say 6 months ago? Okay.
Okay.
So what? All right. What medications is he on?
Yep. So we're gonna need a high blood pressure medication, a cholesterol medication.
Hydrochlorothiazide. How's that?
Sure. Who knows what that treats? What is hydrochlorothiazide?
Hypertension.
Good job. Now we're gonna need
Atorvastatin for high cholesterol.
sure, we can do that one.
I'm sorry, I didn't hear that one. Hold on.
Atorvastatin.
Do we want the dosage of the meds?
Sure, we can totally do dosage.
All right, so for the hydrochlorothiazide, how about
20 milligrams.
okay. And then the next medication was, say that again.
Atorvastatin.
And how much?
25 milligrams.
10.
10 is fine. 10.
1 to 10. Okay.
And let's say he takes
How about he takes,
ibuprofen.
or I was gonna say, and how about he takes a multivitamin? Yeah. Ibuprofen, what, as needed?
Yep. PRN pain.
Yep. And he takes a multi. Okay. That looks good. All right, his dental history. When was the last time Mr. Smith went to the dentist?
Let's say 10 years ago.
What else do you want to know about their dental history?
You could do if they've ever had extractions, if they've ever had root canal therapy, if they've ever had any orthodontics, anything along those lines.
Can we put that he have like a dental implant?
Sure, let's do
Yeah.
it.
Okay. Where? Let's say number 30. 1 year ago.
That one makes sense because he was last there. 10 years
That's
ago.
why I said it. Okay. What else with his dental history? Let's see. How does he do with dental visits? Does he have dental anxiety? Does he have a fear of needles? Does he avoid the dentist? Dental phobia? Possibly. It's been 10 years.
10 years ago. Yes, dental anxiety.
Let's say he's a dental phobic. All right, how about his social history? How do social habits contribute to oral health or oral disease?
Smoking?
Yep.
Maybe.
So maybe he's a smoker. Let's just say like 1 pack a day. What else is?
Their diet, like eating habits.
Yeah.
Yep, you can say that. You can even talk about work too. You could
Yeah.
say he was laid off, a year, for 6 months or something like that too.
We can say his diet is unbalanced. How about we'll say that? Balanced. Was laid off of work. How about this? He just got a new job working nights. That might be contributing to his unbalanced diet. He's not eating or sleeping well. Could be affecting his oral health.
Awesome. All right, so looking at all of the information that we kind of compiled together, can anyone think of any questions that would be good to ask if you were presenting this case study? I mean, I'll start with one. One question you could ask is you can ask what John Smith's ASA class would be.
Class 3.
You could argue it would be a class 3.
Yeah, you could.
You could argue it, yeah.
Too.
You could also argue, you could ask, does John Smith need medical clearance before you treat him?
Great.
Yes. Because he have a joint replacement.
Correct. Now, does he need pre-medication?
Yes, he needs an antibiotic for that.
He may or may
For
not.
the debridement.
Yeah, depending
may or
on
may not.
the orthopedic.
Yeah, it's depending on the orthopedic because it's no longer required, but that is a case. Excellent. And then another question could be about his medication. I mean, you can even go into asking, ibuprofen was taking for pain. What is a dental effect that ibuprofen can cause?
Excessive bleeding.
Yes.
Yeah,
Yeah.
excessive
Things
bleeding.
things like that. So you can delve into the medications. Dental history. So his last dental visit was 10 years ago. Don't know how he got a dental implant a year ago if he hasn't been for 10 years.
I just realized that.
But his dental implant is 10 years old.
Okay.
So if it's been 10 years since he's seen the dentist, what kind of radiographs would you most likely order for this patient?
FMX,
Correct. Fones series. Now, what kind
maybe
of bite wings would you have along with that?
vertical,
Vertical.
Vertical. Correct. If you had to take a PA on one of the teeth, which tooth would you take it on?
number 30.
Exactly. Now, another question could be the patient smokes 1 pack of cigarettes a day. What type of damage could this cause to the dental implant?
Bone loss, more bone loss.
Correct. It compromises the bone structure. Let's say we talk about how the patient was laid off of work and just started a new job. What could this cause that could affect the dental treatment?
loss of stress, you might have a attrition.
Yep. Yes. He could be stressed. He could be grinding. He could be not sleeping well. He could be neglecting. Yep, neglecting. So you have all of these sort of questions that you can ask for when creating your own case study to present.
Right.
His blood pressure was 145/82. He hasn't seen his primary care physician in over a year. Would you recommend that would you refer him to his medical doctor for his yearly examination? most likely. His chief complaint is that his teeth are sensitive to hot and cold. How would you address this chief complaint with your treatment plan? You would go ahead and yes, you would check the sensitivity. You can even use the pulp vitality. You could talk about the importance of x-rays. You can talk about having the examination. If you were to, triage what you're doing, you can say the first thing we're going to do is address this chief complaint. So that's one thing there too. So there's a bunch of things, and just by us making up these questions and kind of looking, you can ask all of these awesome questions when you're compiling yours together. Let's say that he is on the high blood pressure medication and the cholesterol medication. What is one oral side effect that you should be on the lookout when considering his treatment? Probably xerostomia. So you're going to keep that in mind when you're going through everything. So it's these little tiny details. It's great to know how to make it, know how to ask questions, because once you take your boards examination, you'll know kind of what they're looking for and where they're getting their information from and how to read it, because that's a really, really tricky one too.
Right.
So yeah, that
was great.
That was great, everyone. Does everyone feel comfortable with this, or do you want to do another one together, or are we all feeling pretty good?